As in vitro technology has improved, pregnancy rates have increased. The use of assisted fertility techniques has resulted in an increase of multiple births. Although this may seem a positive outcome for infertile couples, the potential risks associated with multiple births are more and more evident. While twins occur in approximately 2% of natural births, over 25% of IVF births have resulted in twins. Triplets are found in 0.1% of natural births, but are as high as 3% in IVF births. IVF multiple births have been decreasing as clinics have encouraged the transfer of less embryos. A single pregnancy resulting in a healthy delivery should be the goal of fertility treatment. Multiple pregnancies are a risk for both the mother and developing fetus. A woman carrying multiples has an increased risk of miscarriage, bleeding, anemia, high blood pressure, diabetes, prolonged hospitalization, and cesarean section. Fetal complications are even more threatening. Multiples tend to be born prematurely, and associated risks include low birth weight, respiratory distress syndrome, cerebral palsy, and even neonatal death. Birth defects in twins and triplets are also significantly higher than in single-birth infants. A few numbers will make these risks very clear. While premature births occur in only 4% of natural births, over 23% of twin births are premature. The low birth weight jumps as high as 55% in twins and 89% in triplets. Less than 1% of natural births are stillborn, while that number jumps as high as 6%, over 6 times as likely for a twin birth.
Similarly, cerebral palsy, which occurs in about 1 to 2 per thousand in singletons, has a 4-fold increase, or about 6 per thousand in twin births.
The data presents a strong case for single embryo transfer.
Finally, everyone knows how exhausting the first years of child rearing can be for most couples. Multiple births can take that to an extreme that's hard to imagine. The maintenance of multiple children can have a devastating emotional, physical, and financial effect on parents and should be considered carefully.
For all these reasons, multiple pregnancies should be avoided. The Canadian Fertility and Andrology Society has implemented guidelines, not laws, in order to help clinics optimize healthy live births and minimize multiple pregnancies. These guidelines take into account factors such as the age of the woman, her pregnancy and fertility history, and the quality and number of embryos. Decisions on the number of embryos to transfer should be made to minimize the risk of multifetal gestation, while maintaining a high probability of a healthy live birth. Single embryo transfer, or SET, is an option with in vitro fertilization. SET is exactly what it implies. Instead of doing DET, double embryo transfer, or transferring multiple embryos into the uterus, a single embryo is transferred. Now, this does not eliminate the chances of a multiple pregnancy, as monozygotic twinning can still occur, but it does significantly lower the chances of multiples. In the last 5 years, there's been a 20% jump in those turning to single embryo transfer in Canada, and many countries in the world have introduced laws which make SET the only method available for in vitro.
Single embryo transfer could take a little longer, but with the availability of freezing embryos, it's been shown to be cheaper in the long run. It has a greater success rate per embryo transferred and is clearly the best option for those wishing to avoid the many risks of multiples.